you've just had cruciate repair on your dog, and you need to know what to do at home. It is really important that you confine your dog and not allow them to run around the house, jump on beds, go up and down the stairs on their own. It will mess up the surgery, and you'll have complications. The other part is to make sure that when you do go outside, they are always on leash. If they are not on leash, they can see a squirrel, they can see a neighbor dog, there can be a deer, there can be things you do not expect, and that again will cause complications. You've invested the money into the surgery, now you have to invest the time into them recovering well. Other part that you're going to have to do is range of motion so that the joint doesn't stiffen up too much and the scar tissue fibrosis gets too tight. So what we really encourage you to do is right after surgery, doing range of motion exercises 4 to 6 times a day, depending upon how much time you have. Range of motion involves doing full extension on the knee and full flexion on the knee. And that's like that and like this. So when you start to do physical therapy and range of motion on your dog, this is going to be immediately post-op. You're going to want to make sure that they're relaxed. You can massage the thigh muscle up here to get them to relax so they'll let you do it. And then you want to isolate motion to the knee. You have to go all the way down, volunteer. To isolate the knee, you need to put your hand in front of the thigh and grab the lower leg down here. You don't want to grab on the foot, because if you grab on the foot, you can hurt. Just like if somebody grabs your hand too tight and squeezes your fingers, it hurts. So grabbing up here is much preferable. When we go range of motion, we're going to push just a little bit on the thigh and extend here. When we flex, just going to push up. We're going to hold the thigh still and isolate our range of motion to the knee joint. All right. When we are pushing up on the flexion, we don't want to crank on it. The dog just had surgery on that. We want to push till we get a little bit of resistance from the dog and then hold for about 5 seconds. The amount of pressure is probably no more than 5 pounds of pressure there. It's not a lot, and you don't want to bounce it. That's not what we're looking for. We're looking for just a smooth hold, extend, hold. Good dog. Flex, hold. And I'd like to see you do 5 to 10 repetitions of that. 5. Good. It's not complicated, but it's very, very important. So after a cruciate surgery, there has been an incision into the skin, either on the lateral side of the knee, on the outside, or on the inside of the knee. There is going to be some bleeding, and so after that's all closed up, you're going to see some bruising. It may be on this incision side, or it may be on the inside of the leg. It can show up 2 to 3 days after surgery. That's very common. It's not a problem as long as there's no active bleeding. It's just bruising from the surgery. The other thing you can expect after surgery is sometimes some edema or swelling below the surgery site, so in the lower part of the leg. That's fairly common. You can help the animal by putting a warm pack on that to help with the swelling. The other thing you can do is flush it, and that's just having some mild pressure, and you push the fluid back to where it belongs. Just flushing it with a moderate amount of pressure all the way around towards the body. That's where you want those fluids to go.